Hi, welcome to POC Nurse. My name is Gozi, and in this video we're going to talk about pulmonary hypertension for the Ccrn exam in the United States. What is pulmonary hypertension? It's pretty much high blood pressure in the vessels of the lungs. In terms of numbers, pulmonary hypertension is a mean pulmonary artery pressure that's greater than 25 millimeters of mercury when a patient is at rest, and a pulmonary artery occlusive pressure that is less than 16 millimeters of mercury when a patient is at rest with secondary right heart failure. Right? The normal mean pulmonary artery pressure is approximately 20 millimeters of mercury. So we all know that the right side of the heart pumps into the pulmonary artery to go to the lungs, and the right side of the heart is not that muscular. It's less muscular than the left ventricle. So the left ventricle does a lot more work pushing blood out of the heart to the entire body. The right ventricle, on the other hand, just pushes blood from the right ventricle into the lungs. So it doesn't need that much muscle because it usually will push blood into a low pressure system. But in the case where we have pulmonary hypertension, the lungs are no longer a low pressure system. They become a high pressure system for the right ventricle to pump into. So if the pulmonary hypertension persists and the right ventricle has to pump into this high pressure, at some point it's going to start to fail. So pulmonary hypertension could result in cor pulmonale and right ventricular failure. Cor pulmonale is pretty much pulmonary heart disease. Now, there are 5 groups of pulmonary hypertension, and this was put out by the World Health Organization, and it's basically based on cause. So we have group 1 through group 5. Now, group 1 is pulmonary arterial hypertension, and it's usually associated with abnormalities in the arterioles, the small pulmonary artery branches, and idiopathic pulmonary hypertension. So this could be caused by collagen vascular diseases. It could be toxin induced, or it could be drug induced. Group 2 pulmonary hypertension is caused by left heart disease like cardiomyopathy, diastolic dysfunction, or mitral valve disease, as well as aortic valve disease. In group 3 pulmonary hypertension, we're talking about lung disease. So the pulmonary hypertension is associated with lung diseases like COPD, interstitial lung disease, or obstructive sleep apnea. Now, this is group 3 that we just talked about. We're going to talk about group 4 pulmonary hypertension. This one's related to chronic thromboembolic disease. So we're talking about embolus moving around in the body. So it's associated with fat, tumor, parasites, or foreign materials in the body. So group 4 is related to chronic thromboembolic disease. Group 5 pulmonary hypertension is a pulmonary hypertension that doesn't fit in the other 4 categories. So all the other reasons that the patient could have pulmonary hypertension is thrown into this group 5 basket. So when we talk about signs and symptoms of pulmonary hypertension, we think about what we see and what the patient might complain about. The patient might complain that they're having dyspnea, that they're short of breath. You know, that when they start to exercise, they get short of breath. And they might complain of fatigue. They might say they're lethargic. They might complain of chest discomfort, chest pain, palpitation. They may be cyanotic. They might complain that they've been passing out or near passing out. They might complain of syncope. This patient might be tachypnic. The patient might breathe with the use of accessory muscles. They might have a cough. They might cough up blood. And they might look like they have right-sided heart failure. So you're going to have them having jugular vein distension. They'll have peripheral edema. Their legs will be swollen, hepatomegaly. Their livers will be swollen, and they might have a murmur of tricuspid regurgitation. Now, when we talk about diagnostic tools for diagnosing pulmonary hypertension, the gold standard is doing a cardiac cath. That's a right-sided, a right heart cardiac cath. When we do that, we can diagnose the patient with pulmonary hypertension. This is the gold standard for diagnosing a patient with pulmonary hypertension. That's doing a cardiac cath. Moving on, how do we treat a patient with pulmonary hypertension? Remember, when you're studying for the Ccrn exam, in my opinion, what you need is knowledge. You just need to know what's in the book. If you have time to read the book, good. If you don't have time to read the book, you could listen to audio study guides like this. You could listen to video study guides, whatever. You just need the knowledge. So some of these things might sound repetitive. They might sound like things you know, but it's actually what you need to know to pass the exam. And sometimes the book contradicts what we do in real life. So that's why it's important to read the Ccrn book, go by what they say in the book so that you can pass your exam. I'm not so sure why I segued into this, but let's move on. So we're talking about how do we treat the patient with pulmonary hypertension. Well, if we're able, we treat the underlying cause of this pulmonary hypertension. And remember, we have 5 groups of pulmonary hypertension. So each group has its own specific treatment depending on its cause. And regardless of what we do for treatment, one should consider giving oxygen because the patient gets short of breath, diuretics, anticoagulants, digoxin, and exercise training. Now we can also use medications that can dilate those vessels, such as calcium channel blockers or phosphodiesterase 5 inhibitors such as Viagra, Cialis, etc. For patients who don't respond to medical management or all medical treatment, they might require a lung transplant or a possible atrial septostomy. This is where we end this video for pulmonary hypertension for the Ccrn exam. I hope you found this video useful. Thanks for listening, and I'll see you in the next video. Please like, share, and subscribe. Bye-bye.